The opinions expressed on this program are solely those of individual participants and do not necessarily reflect the views of either Spectrum Generations or Time Warner Cable. Mature Lifestyle is made possible by Hollywood Slots of Bangor, where every player's a star, and by Knowlton Hewins Roberts Funeral Homes and Cremation Service. Our homes are warm and welcoming, and we take care of you and your family like we would our own. Call us anytime. We are here for you.
Welcome to Mature Lifestyle. I'm Dot Freeman. We recently just celebrated the first anniversary of ACA, the Affordable Care Act, and the whole issue is still unfolding. Two things that have already come out of the Affordable Care Act are reduced prescription drug prices for seniors and introducing new preventative health benefits. Today we're going to talk about more of the details with my two guests. Join me in welcoming John Nale. John is an elder law specialist in Waterville. And John, tell me a little bit about what it means to be an elder law.
As an elder law attorney, we work with seniors and their families, always helping them understand the legal and financial issues that go along with aging. I also serve as volunteer president of the Maine Association of Area Agencies on Aging.
Mm-hmm. And next to John is Ann Smith. Ann is a Medicare Rights Advocate, and Ann is with the Legal Services for the Elderly here in Maine. And what do you do in that role, Ann?
Well, basically, I support all the area agencies on aging with their work with seniors and help seniors who have encountered problems with their Medicare. And that could be getting denied coverage for reasons they don't understand, and sometimes it should not be denied, so I help them appeal those situations. And basically I work with Maine citizens on Medicare to access all their Medicare rights and protections.
All right, thank you, Ann, and welcome, John. Let me go back to the Area Agencies on Aging, which is a mouthful, because you've both referenced it. And John, as you indicated, this is a nonprofit organization. You're the president of that organization, which means you're a volunteer. And the Area Agencies on Aging came as a result of the Older Americans Act and the progression of that, which started in 1965.
Right.
And Maine is served by 5 area agencies on aging. If I can just recap these briefly. The first is the Aroostook Area Agency, which serves the county. The Eastern Area Agency on Aging, which serves Penobscot, Piscataqua, Hancock and Washington counties. Senior Plus, which serves Androscoggin, Franklin, and Oxford counties. Southern Area Agency on Aging, which serves York and Cumberland County, and Spectrum Generations, which is the host of this show, which serves Kennebec, Knox, Lincoln, Sagadahoc, Somerset, and Waldo counties, as well as Brunswick and Harpswell in Cumberland County. And the Area Agencies on Aging, in a very broad brush way, were brought in the early 70s, 1972, I believe, focusing on social and nutritional needs of older Americans. Is that about?
Correct.
So tell me, what does, and it's called M4A, the Maine Association of Area Agencies on Aging, the nonprofit that which you're a president. So what do you do in that role?
Our mission is to improve the quality of life for Maine's 225,000 seniors aged 60 and above, and we do that through the different centers that we have throughout the state, providing counseling for Medicare and other types of insurance, and as well as nutrition. We also provide Meals on Wheels and also social activities at our different centers throughout the state.
And this also involves information and referral services, asking and getting answers to important questions that seniors and disabled adults would have.
Exactly.
And you also have an advocacy role. What is that?
Well, the advocacy role is at the federal level, the House of Representatives, of course, in the Senate, and we also advocate at the local level as well. Right now, we have sponsored 5 different bills in the state legislature, all aimed at improving the quality of life for Maine's elders. Several of them have to do with insurance, Medigap policies, long-term care insurance. Again, protecting the rights of the elders, making sure that their coverage stays in place, and any other way that we can, again, improve the quality of life for Maine's elders.
So really, you are the voice of older Mainers.
Yes.
People age 60 and older.
Yes.
And the Maine Legal Services for the Elderly, this too is a nonprofit organization.
Yes, it is.
And you folks have been around since 1994. So help me make sure I'm getting this correct. The Maine LSE provides legal help for Maine seniors. You have 5 offices in Augusta and Bangor, Lewiston, Presque Isle, and Scarborough. So again, for people ages 60 and older, you provide free legal advice on health care, health insurance, Medicare, Maine Care, Social Security, pension and retirement benefits, power of attorney, financial abuse, and guardianship defense kinds of issues. Is that right?
We do.
So people can call in and they will speak with a live attorney right online. Is that right?
Well, the way it works is with the helpline is that there is a paralegal who takes the calls, and then they will be called back by one of the attorneys. The turnaround is really quite quick.
Yeah, and this is free.
It's free.
Absolutely free.
And for matters that the helpline does not deal with, we do have a referral list to reduced rate attorneys for people who are of lower income. So that kind of referral would also be made because.
Sure. So Maine, written out, mainelse.org. And if you want to call, it's 1-800-750-5353. So let me turn to some questions that people have about the ACA, the Affordable Care Act. First of all, as I said at the top, this has helped to provide some prescription drug savings and also offering some preventive health services. The focus is on home and community-based access to health care. Is that a fair statement?
That's going to be the focus.
That's where we really want to be.
Right,
Okay.
and preventative care as well.
Let's talk about what kind of better preventative care, because the ACA will be phased in. We will see that more elements of it come into effect as time goes on. What about preventative care, John?
A major part of the benefits that in the Affordable Care Act for elders under the Medicare provisions has to do with preventative care. Elders are now going to be allowed a free annual wellness exam, and they're going to be able to participate in a free annual wellness plan. The purpose here is to have the elder engage in a lifestyle that is going to be healthier so that we can avoid the health costs that are associated as we age. Some of the other free preventative care, we're going to be allowed free screenings for different types of cancer: colorectal cancer, prostate and breast cancer, bone marrow measurement, diabetes screening, and aortic aneurysm screening. Again, it's prevention. That is going to result in a substantial savings over the course of the Medicare program.
So what we're seeing is preventative care, an annual wellness visit, so that we can preclude or head off early any of the most serious kinds of chronic illness, whether that be diabetes, heart, cancer. This has PSA tests and
Exactly.
and mammograms, all of those things designed to keep Maine's elders healthier longer.
Exactly.
And reduce costs.
And I think an important thing for elders to understand is that these benefits are free of charge.
I don't think you can say that too often, Ann. You want
Right.
to say that one more
It's
time?
free of charge. There's no deductible, there's no copay, there's no coinsurance. Because in the past, some of these benefits have been available, but there have been costs associated
Yes.
with it, and that's prevented people from taking advantage of the benefits.
Now, is that available in this first year, in
It is
2011?
available currently.
Right now, people
immediately.
can take advantage of that. If
Immediately.
they have not done that, would you both encourage them to get that annual wellness visit scheduled?
Absolutely.
Yes, absolutely.
And participate in the annual wellness plan that the doctor is going to put them on and follow them throughout the year.
Right, because with that plan, the physician should be indicating to them what preventive services they should be accessing and when they should be accessing those.
Tell me about that. What might that include? What kind of a
Well,
wellness?
that would be when they should have their mammogram or pap smear, just a schedule of the preventive benefits that are available to them and when they should take advantage of that.
All right.
And I know that the area agencies on aging through the Senior Medicare Patrol Project have a little health journal, and we are revising that health journal to have a section about these preventive benefits so people can check off when they have their benefits and put the dates in so that they can do that on a yearly basis.
All right. Now, the area agencies on aging, which covers the entire state.
Yes.
This is closely affiliated with your organization.
I work
Tell
very
me a
closely.
little bit about that.
Well, I mean, we are all part of the State Health Insurance Assistance Program, or the SHIP program, which
SHIP.
people may have heard of. And the way LSE works with the area agencies on aging is, I do a lot of training for staff and volunteers, and I am available to each of the agencies when they encounter complicated Medicare issues, because they have a lot of day-to-day work they do, and so the more difficult things come to me to resolve.
All right. John, let me ask you one more question, and this isn't the preventative part, but it is help with prescription drug costs. Can you give me a thumbnail sketch of what the ACA will provide to seniors?
Over time, under the Affordable Care Act, you're going to see that donut hole or that gap in coverage under the prescription drug plans. You're going to see that eliminated between now and 2020. Last year, if somebody reached that donut hole, a gap in coverage, and that gap in coverage begins after either the insured or the insured's insurance pays about $2,600, then the gap kicks in and there's no coverage for about the next $3,000. Well, that $3,000...
Hence the word the donut hole.
Hence
There's
the word the
gap.
donut hole. Now that $3,000 gap is going to close over time. Last year, if somebody reached the donut hole, they received a $250 payment from the federal government, and approximately 3.5 million people did reach that donut hole gap.
How about here in Maine? Do you know?
Here in Maine, you're going to have about probably 25,000 people who reach that donut hole gap.
A substantial number of people across the state of Maine hit that and needed that.
So yes, so along the lines of prevention, again, what the Affordable Care Act does is that it prevents the pharmaceutical companies from reaping excessive profit.
Sure.
So what they're going to do is over time, this year here, the pharmaceutical companies have to offer a 50% reduction in the cost of name brand drugs.
Yes.
And then over time, that's going to shrink so that it's going to increase so that the donut hole is going to shrink over time. And by 2020, the donut hole is going to be eliminated. But the bottom line is the Medicare recipient is going to pay about 25% on average of their drug costs.
Okay, we have lots more to talk about. We'll be back with John Nale and Ann Smith. You come back and join us too.
There's no place like Hollywood. From the newest slots to blockbuster jackpots and all the excitement you can handle. This is where you're in the spotlight. You're the star. A place where the action never stops and the night is always young. Hollywood, the name says it all.
Spectrum Generations. Live healthy, live well. Get answers. Get connected. Spectrum Generations, specializing in the art of aging.
Life should be celebrated. It's a special day when family and friends gather together to celebrate the life of a loved one. A celebration of life helps us honor our loved one and keep our memories alive. Whether you're planning a traditional funeral, a creative celebration of life, or a blend of both, at Knowlton Hewins Roberts, we are truly committed to meet the personal and unique needs of you and your family. Knowlton Hewins Roberts. Visit us online or visit our 2 locations in Augusta and Winthrop.
Welcome back. We're talking about the Affordable Care Act with John Nale, who's the president of the Maine Association of Area Agencies on Aging, and Ann Smith from the Maine Legal Services for the Elderly, who is a Medicare Rights Advocate. As we've been talking about the ACA, the Affordable Care Act, and how that is transitioning in and some of the changes, one area that we're going to be seeing is reduced payment to the Medicare Advantage plans. Can you tell us about that, Ann? What should we be looking for? What will we expect?
Well, currently, Medicare Advantage plans have higher administrative overhead than traditional Medicare. And what the Affordable Care Act does is bring the payments to Medicare Advantage plans more in line to what traditional Medicare costs.
And what does that mean to Maine seniors? What should they be aware of?
What it means is, I think Maine seniors have heard that they're going to lose Medicare benefits.
And is that true?
That isn't true. What it may mean is with Medicare Advantage plans, some of those plans have benefits that are in addition to benefits in original Medicare. There may be some eyeglass coverage or some dental coverage, but that comes with a cost. And at this point, if they reduce the payments, some of those additional benefits may go away. Or some of the plans may decide that it's not profitable enough for them to continue serving Maine seniors. So those plans might go away. However, Maine seniors would still have access to traditional Medicare and all their Medicare benefits. So it's not really a loss. It may be a change if they are currently in a Medicare Advantage plan that changes in a way they don't like or goes away, but they can always go back to original Medicare.
But if people are hearing conversation, and it's a frightening conversation, the word cut, you're telling us don't be afraid of that. There may be some changes, but the basic...
And what they should really hold on to is their Medicare is improving. The Affordable Care Act is good news for seniors because it does improve their Medicare benefits.
Okay, good news for seniors. John, let me ask you about provisions designed to reduce waste, fraud, and abuse. Where do those fit into the ACA?
So when we talk about, or when there is talk about the Affordable Care Act reducing Medicare by $400 billion over the next 10 years, a large part of it comes from preventing waste, fraud, and abuse. And
That's a serious problem then.
Right. And the waste, fraud, and abuse that we're talking about is not the waste, fraud, and abuse committed by the elder. It's the waste, fraud, and abuse that's committed by insurance companies, large providers of health care, hospitals, pharmaceutical companies. It's that type of waste, fraud, and abuse that the Affordable Care Act is designed to go after and eliminate.
How do they go about that, John? How do they identify where that is, and how in fact do they go after it? Well,
right now there is funding to create 20 task forces to, in conjunction with the FBI, to work in large cities throughout the country to go after this waste, fraud, and abuse that is perpetrated by the large providers. Now, there aren't a lot of them that are doing it, but the amount that they do is significant. So the idea is to eliminate that altogether. And what they do is that they bill Medicare for services that aren't provided. Right. They bill Medicare for products that aren't provided. A large part of it has to do with providers of medical equipment and getting that out there to the public, charging them for it when either it's not needed or it's not delivered at all.
And it's estimated that this can save us $60 billion with a B dollars a year.
Exactly.
That's a lot of waste, fraud, and abuse. But your point is, it's not on the part of seniors.
No.
It's by some bad actors who are among the providers.
And what seniors can do is really pay attention to the Medicare summary notices that they get. You know, and
Tell
not
us about that.
well. On a quarterly basis, seniors get a statement that tells them that the service is provided, and generally, if they don't have to pay anything, people don't look at them very closely.
And these come in the mail.
They come in the mail, and so they should, and if they have difficulty understanding them, they can always call me at Legal Services for the Elderly, and I can help review it for them. But they should check and make sure that the services for which they've been billed are services that they have received. And that
So the public can help out
the
with
public
identifying some of this waste,
The public
fraud,
can be a
and abuse.
huge help.
Yeah, so double check that system.
Double check the system.
Very good, okay. And another provision of the Affordable Care Act, and John, let me take this to you, helping seniors find and locate long-term care at home. What's the significance of that? How does that work?
Well, as an elder law attorney and working with elders and their families, we know that virtually all elders want to be able to age and live at home and to be cared for at home for as long as possible.
But is that really the cost-efficient way for people to be at home?
Yes, it is. It's estimated now that we spend 4 times to house a person in a nursing home or an assisted living facility compared to the cost of keeping that person at home. What we need to do is we need to rebalance those numbers, okay? And in the Affordable Care Act, there are incentives there for the states to encourage and to develop an at-home care system so that we can stay at home longer and be cared for at home longer. But we do need to train more people to be able to provide those services.
Sure.
But nevertheless, there are tremendous savings, and we satisfy the wants of the elder to be able to stay at home.
I think that's an essential point, that, first of all, people prefer to be at home.
Absolutely.
They want to be independent. At the very least, they want to be in their home community. Right. But the larger point here is that it is 4 times more costly to take someone out of their home, when in fact they'd probably prefer to be at home. And so we're able to help people identify more of those opportunities, but you're also saying that in order for people to have those opportunities, more services need to be available.
Right.
Exactly.
Right.
According to the state's own figures, it costs approximately $80,000 a year for a person in a nursing home.
Really?
Yes.
And for $20,000 a year, they can
Keep
stay
them at
in their
home.
own home. And are you hearing that same thing from people?
Totally. I mean, people want to age with dignity and have the comforts of their homes and family around them.
Okay, let me ask one more question. We're on such a roll here. Let me ask, what is meant by CLASS, which is the Community Living Assistance Services and Support? Briefly, what is that?
Well, the CLASS Act is providing an opportunity for people to save for long-term care, to put money away ahead of time that will be available for them to use for their long-term care later. And it would be in a tax-deferred basis for them. And it's an opportunity that doesn't currently exist. I think that the bugs are still being worked out as to exactly how that's going to function, but it's a wonderful opportunity for people who will have the chance to plan for their long-term care.
And that planning is important. As an attorney, I'm sure you see people that haven't planned, and that this opportunity to plan makes all the difference for them.
Exactly.
Yeah.
Exactly.
Any other quick final moments that you want to tell us about the ACA?
The bottom line is that overall for Medicare recipients, there are substantially more benefits coming from the Affordable Care Act. There aren't going to be any cuts in benefits. So the Affordable Care Act ought to be supported by all of Maine elders.
Okay, Ann Smith, thank you so much for being with us. John Nale, thank you for being with us. If you want to reach Ann, you can call at 1-800-750-5353 or go online to Maine, M-A-I-N-E, LSE for Legal Services for the Elderly.org. It is a 501c3 organization. They will accept your tax-deductible donation. And you can also contact John Nale, the Maine Association of Area Agencies on Aging, M4A.org. Thank you both for being with us.
Thanks
We
for
have a
having us.
lot to learn, but it looks like the news is pretty good out there, doesn't it?
Absolutely.
Very good news.
Wonderful. I'm Dot Freeman. This is Mature Lifestyle. We'll see you soon.
Spectrum Generations. Live healthy, live well. Get answers, get connected. Spectrum Generations, specializing in the art of aging.
There's no place like Hollywood. From the newest slots to blockbuster jackpots and all the excitement you can handle. This is where you're in the spotlight. You're the star. A place where the action never stops and the night is always young. Hollywood, the name says it all.
If it's June in Maine, it must be time for the Healthy Aging Expo at the Cohen Center in Hallowell, Maine. I'm joined by Maggie Tardif, who's the center coordinator of the Cohen Center. Third annual, huh?
Third annual.
What's it all about?
Well, it's a day of communities coming together to offer health, information, wellness, new product ideas to adults of all ages, and it is absolutely free for anybody to come in that day.
And what is that day?
The day is Friday, June 10th from 9 a.m. to 3 p.m.
And you're located on Town Farm Road?
22 Town Farm Road in Hallowell.
Okay, and you've done this is the third annual.
It is. We started, it was supposed to start as a small health fair, and it has grown. This is our third year doing it. We have over 30 vendors in there. There'll be about 15 to 20 free health screenings.
What kinds of health screenings?
Osteoporosis screenings, blood pressure, heart screenings. There's cholesterol screenings, spinal analysis, nervous system scans, hand reflexology.
And all of these are free?
Absolutely free. Come in, check out all the booths and the vendors. We are being sponsored this year again by Maine General Health, who will also be bringing in their Wii Fitness system, which is good for your nervous system, your cardiovascular system, play golf, tennis, all on the Wii machine.
Okay, how many people typically come to one of the Healthy Aging Expos?
Last year we saw a little over 200. We're hoping for more this year. We have some great media sponsors, and for those who like country music and the oldies, we have B98.5 broadcasting live.
Wonderful.
We'll have 92 Moose broadcasting live, and we will also be having Cool AM radio there with Citadel Broadcasting. And Mountain Wireless will be there broadcasting their true oldies under the big tent, where we'll have cooking demos and food for sale.
Sounds great. Do you have that Johnny James fellow coming from Moose 92?
They haven't told me exactly which DJ I'm going to be getting, but probably John James.
Can't do any better than that.
Absolutely
Maggie
not.
Tardif, the Cohen Center, and this is for the Healthy Aging Expo. I'm Dot Freeman. This is Mature Lifestyle. See you next time.
Mature Lifestyle is made possible by Hollywood Slots of Bangor, where every player's a star, and by Knowlton Hewins Roberts Funeral Homes and Cremation Service. Our homes are warm and welcoming, and we take care of you and your family like we would our own. Call us anytime. We are here for you.
You're watching TWC TV, only on Time Warner Cable.